House Bill 2700, the Access to Birth Control Act. Colleagues, this bill has two components. First, House Bill 2700 will correct discriminatory practices in insurance coverage by requiring health insurance plans to include coverage for prescription contraceptives in the same manner that other prescription drugs are covered. According to research, approximately 1/3 of Oregon women with health insurance report that their policy does not include contraceptive coverage. As a result, thousands of Oregon women pay out-of-pocket costs for this basic medical care. Already 26 states have enacted similar laws, and it is time for Oregon to join them. The second component of House Bill 2700 will ensure that victims of rape and incest have access to emergency contraception in hospital emergency rooms. According to data from the Centers for Disease Control and Prevention, 1 in 6 women, I want to repeat that, 1 in 6 women report experiencing a rape or an attempted rape at some point in their lives. Offering emergency contraception to victims of sexual assault is compassionate, basic health care for women and will help keep these victims from undergoing the additional trauma of an unintended pregnancy as a result of rape or incest. This is a common sense bill, colleagues, that will provide greater access to birth control for Oregon women, as well as ensure that all victims of sexual assault receive the best medical care possible. I urge your aye vote. Thank you.
Move a little bit. Thank you. Colleagues, it is my great pleasure to rise today in support of House Bill 2700, a bill that has been a long time in getting to the floor. In fact, 14 years have gone by since this legislation was first introduced. And today is the day for the women of Oregon to finally achieve fairness in basic health care. House Bill 2700 does two very important things. First, it requires that if you have prescription drug coverage in your health care plan, that coverage will also cover prescription birth control the same way it does any other prescription. We've called that by various names. We've called it contraceptive equity. We've called it a prescription for fairness. But the bottom line here is that birth control is part of basic health care for women, and it should be treated as such, and that's what this part of the bill will do. In addition to that, the bill also has another important provision, and this is for the tragedy of rape and sexual assault victims who go to the hospital emergency room. They must be given the crucial information about emergency contraception and also the opportunity to actually get emergency contraception in the emergency room. We really do not want rape victims to be out looking for a pharmacy that's open in order to fill a prescription. They should be able to get their needs met right then and there at the hospital. Colleagues, this bill has been around for a long time, as I said, but there are some very important things about it that I want to point out to you. We know that women have much greater out-of-pocket costs for health care than men do, and in fact, the figure is that women of reproductive age are paying on average 68% more in out-of-pocket costs for their health care, and most of that is because of the failure of insurance companies to cover prescription contraception. In addition to that, we know that about half of all plans still are not providing this coverage. Many have come along voluntarily, but many have not, and that is why we need this legislation. More than half of all pregnancies in the United States today are unintended pregnancies. And whether you're pro-choice or not, you can feel good about voting for this bill because it's a bill that everybody can agree will prevent the need for abortions and prevent those unintended pregnancies. But ultimately, colleagues, it is the women of Oregon and their families who stand to gain from this bill in every way. They stand to gain in terms of their pocketbook. They stand to gain in terms of their welfare, that of their families. Their basic health care needs will be met. 26 states have already passed this legislation. It is long past time for Oregon to join those states and become one of the states that does this for their citizens, for the women of Oregon. So please join me today in standing up for the women who are here today to see it happen, for the women in your district, young or of reproductive age, and their families who really need this legislation. Please join me in casting your aye vote for House Bill 2700. Thank you, Mr. Speaker.
Thank you, Mr. Speaker and colleagues. Being part of the Human Services and Women's Wellness Committee, I just want to rise at this time and share with you just a tad bit my feelings on this bill, House Bill 2700. Initially, I'll just be candid with you. I was not real supportive of this bill. There's a portion of it I absolutely agreed with, but now as we've worked together as a team, and that's what I greatly appreciate, the leadership from our chair on that committee as well as everyone else that are members, we got to a point where we are now bringing to this floor a bill that I am very thankful for and do appreciate having right now. So with that, I urge your aye vote.
Thank you, Mr. Speaker. First of all, before I speak to the bill, I'd just like to thank the carriers and the committee, and I would like to thank the Speaker and the majority leadership bringing this bill here to the floor. It's a long time coming, and I would be remiss if I did not express my gratitude for that. To the bill, please. To the bill. In 2003, as a freshman legislator on the Business, Labor, Consumer Affairs Committee, my good friend from Southeast Portland came and asked me if I wanted to join on a minority report that would bring contraceptive parity to the floor. And after explaining to me what all that meant, I said yes. and we came here to the floor with that bill, and my good friend from West Salem showed some great courage in supporting us with that bill, and I'm glad to say both these fine women and friends of mine are on the bill, and I'm proud of that. We failed that day, and I went home that day to my daughter, and I held her cherubic face in my hands, and I looked her in the eye, and by the way, with the miracle of life staring back at me from those beautiful eyes, and I said, "Today your old man fought for you." And I'll never forget it, and I'm shaking with pride because of that. Now, today I'm going to go home, and I'm going to hold her beautiful, now she's 13 years old, and she is participating in her decisions with her mom and dad, and soon, and I hope it takes a long time getting there, she, like her wonderful mother before her, will be making her own decisions. But today I'm going to go home today, and I will hold her beautiful angelic face in my hands, and I'm going to tell her, today, your old man fought for you and for all the little girls and all the women in the great state of Oregon. But today we won. So thank you very much, Mr. Speaker. I urge everyone's aye vote.
House Bill 2700A, having received a constitutional majority, is declared passed.